Human metapneumovirus, HMPV outbreak, a significant and expanding viral threat. A virus hiding in the shadows for years is suddenly everywhere. You know, COVID, the flu, RSV, but have you heard of HMPV? It's exploding across northern China, overwhelming hospitals. Is this the next pandemic? This video explains everything about HMPV, why it's spreading so fast, and how to protect yourself and your family. You really need to see this. It could be a lifesaver. 1. Current situation. China's facing a huge outbreak of human metapneumovirus, HMPV, a common respiratory virus that's become a serious problem this winter. It's spreading like wildfire, especially in the colder northern provinces. Perfect conditions for the virus. Kids, especially those under 5, are getting hit the hardest because their immune systems aren't strong enough. Pictures from hospitals show crowded, mask-wearing people, desperate for treatment. It's bringing back awful memories of the early days of COVID. The government's trying to keep track of unexplained pneumonia cases to catch things early, but it's worrying. Taiwan and Cambodia are warning about HMPV, especially for kids, the elderly, and people with weak immune systems. Malaysia's seeing a big jump in cases too. This isn't just a China problem anymore. The cold weather's making things worse, and after all the COVID lockdowns, people seem to have let their guard down. I'm really worried about this. 2. What is HMPV? China's facing a huge surge in human metapneumovirus (HMPV) cases, a common respiratory virus, but it's become a serious worry this winter. It's spreading like wildfire, especially in the northern provinces, where the freezing weather is making things worse. I'm really worried about how quickly this is escalating. It's heartbreaking, especially for little ones under 5. Their immune systems aren't fully developed yet, making them so vulnerable to viruses. Hospital photos and videos show crowded, masked people struggling to get medical care. It's eerily reminiscent of the early days of COVID-19, when hospitals were completely overwhelmed. This is worrying. Chinese health officials are closely monitoring cases of unexplained pneumonia. It's really worrying. They're trying to catch anything suspicious early to stop it from spreading, but it's still pretty scary. Taiwan and Cambodia are warning about a surge in HMPV infections, especially for kids, the elderly, and people with weak immune systems. Malaysia's seeing a huge jump in cases too. This isn't just a China problem anymore, it's spreading. I'm really worried about this, bar our cold weather's here, and with it, a higher chance of catching those nasty respiratory illnesses. And to make things worse, after all that COVID-19 distancing, people seem to have let their guard down. It's spreading like wildfire. The current situation in China shows the HMPV outbreak isn't just a domestic health issue. It could easily spread to neighboring countries. We really need international cooperation to control this, and people need to be more aware of the risks and how to protect themselves. It's pretty worrying. 3. Who is most at risk? Little ones are so vulnerable because their immune systems aren't fully developed yet, leaving them defenseless against viruses. Most kids get HMPV for the first time before age 5, and that first infection is usually the worst, especially for babies aged 6 to 12 months. It's scary because common complications include bronchiolitis, pneumonia, and breathing problems that need urgent medical attention. What's really worrying is that HMPV is a leading cause of hospitalizations for young children with severe respiratory illnesses. It's so scary how easily older people can get hit hard by this. Their immune systems just aren't as strong as they used to be, so they can't fight off the virus as well. And if they already have things like COPD, heart problems, or diabetes, it's even worse. Those conditions make everything so much riskier. The worst-case scenarios are terrifying. Severe pneumonia, trouble breathing that just won't go away, and a much higher chance of death if they don't get help quickly. This includes people undergoing cancer treatment, organ transplants, or taking immunosuppressants, those with asthma, COPD, or other chronic respiratory illnesses. Oh no, the virus could easily spread and seriously damage their lungs. Pneumonia and respiratory failure are much more likely for them. Oh no, HMPV spreads so easily through coughs and sneezes and direct contact. Crowded places like schools, daycare centers, and nursing homes are breeding grounds. Poor hygiene just makes things worse. It's so easy to touch a contaminated surface. This is especially worrying for little kids in daycare, elderly folks in nursing homes, and healthcare workers who are constantly exposed. Pregnancy weakens a woman's immune system to protect the baby, making her more vulnerable to viruses. While we don't know much about how HMPV directly affects the baby, respiratory infections in pregnant women can make breathing difficult, impacting both mom and baby's health. It's really worrying. People who've had a bad case of HMPV are at risk of getting really sick again if their immunity isn't strong enough. A second infection is usually milder, but serious complications are still possible, especially for older adults or people with underlying health conditions. It's worrying, isn't it? Little kids, older folks, and anyone with a weak immune system are the most vulnerable to HMPV. Seriously, it can cause really scary complications like pneumonia or breathing problems if it's not caught early. We need to be extra careful and watch out for symptoms in these high-risk groups. We've got to do everything we can to protect them. 4. How does it spread? HMPV spreads so easily. When someone coughs, sneezes, or even talks, tiny virus droplets fly into the air. These can get into your nose, mouth, or eyes, and bam, you're infected. The droplets don't travel far, maybe just a couple of meters, but crowded places like classrooms, daycare centers, or offices are breeding grounds for this stuff. It's seriously worrying. It's so easy to catch this. Direct contact, like shaking hands, hugging, or kissing someone who's sick, can spread the virus through their skin or bodily fluids. Kids are especially vulnerable since they're always touching each other. And of course, caregivers and healthcare workers are at higher risk too. This is scary. The virus can live on surfaces like toys, phones, tables, even doorknobs. You touch something contaminated, then your eyes, nose, or mouth, and bam, you're infected. The worst part, it can survive for hours on those surfaces. Depending on the conditions, not washing your hands properly after touching something with the virus on it. That's a total recipe for disaster. And covering your coughs and sneezes with your hands, then touching other people or things. Seriously, that's how this stuff spreads. Oh no, cold weather is here. Winter and early spring are prime time for viruses to thrive. The cold really weakens our natural defenses, making us more vulnerable. And crowded, poorly ventilated places, schools, nursing homes, hospitals are breeding grounds for germs. I'm so worried about getting sick. Little ones, their immune systems aren't fully developed yet, plus they're all crammed together in daycare. Older folks, their immunity is already weaker, and they're often around places with higher risks of infection. Healthcare workers, they're dealing with HMPV patients directly. It's so easy to catch the virus from droplets or contaminated surfaces. We're really worried about them all. Wash your hands often, really, really often. Use soap and water for at least 20 seconds. If soap's not available, use hand sanitizer with at least 60% alcohol. Cover your coughs and sneezes with your elbow or a tissue, please, not your hands. Try to avoid close contact with others. No hugs or handshakes, especially if someone's sick. Wear a mask in crowded places just to be safe. Wipe down surfaces, doorknobs, phones, your desk, everything you touch a lot. And if someone's sick, it's best if they stay home to avoid spreading things around. I'm so worried about this. Human metapneumovirus, HMPV, spreads easily through coughs and sneezes, direct contact, and contaminated surfaces. Knowing how it spreads is crucial, so we need to be extra careful. Good hygiene, keeping our surroundings clean, and avoiding sick people are key to masking. We need to protect ourselves and others. This is serious. 5 symptoms common, mild symptoms. Upper respiratory, runny nose, lots of mucus like a regular cold. Cough, dry or phlegmy cough, usually lasting a few days. Nasal congestion, makes it hard to breathe, especially when lying down. Sore throat, scratchy, painful throat, especially when swallowing. Mild fever, usually under 38.5 degrees Celsius, with fatigue. Serious symptoms, lower respiratory, shortness of breath, rapid breathing, breathlessness, may need oxygen. Pneumonia, high fever, chest pain, persistent cough, wheezing. Bronchiolitis, especially common in young children with wheezing. Cyanosis, bluish skin due to lack of oxygen. Complications, in young children, severe pneumonia, acute respiratory distress, often requires hospitalization if not treated promptly. In older adults or those with underlying conditions, worsens chronic respiratory illnesses like COPD or asthma, risk of respiratory failure if not treated properly. Oh no, this sounds scary. It's so scary. The diagnosis is based on respiratory symptoms, fever, and fatigue. Little kids and older people are especially vulnerable, especially during winter and spring if they get really sick. Tests like PCR, that's a super accurate virus check from a respiratory sample, and chest x-rays to see if pneumonia's set in can help. There are also rapid antigen tests available at clinics. Home treatment, symptom care, rest. Help your body recover faster. Hydration. Drink plenty of water, juice, or electrolyte drinks to avoid dehydration. Fever reduction. Use paracetamol or ibuprofen to reduce fever and sore throat. Decongestion. Use saline nasal spray or a humidifier. Over-the-counter meds. Use cough medicine or antihistamines to ease congestion and coughing. Hospital treatment. Hospitalization for severe cases, necessary for young children, the elderly, or those with underlying conditions experiencing serious complications. Supportive measures. Oxygen therapy, for patients with shortness of breath or severe pneumonia. IV fluids, for patients who are dehydrated or unable to hydrate themselves. Corticosteroids, to reduce inflammation in cases of severe pneumonia or asthma. Oh no, I hope things get better soon. Compared to the common cold, early HMPV symptoms are similar, but it's much scarier because it can turn into pneumonia or bronchitis. Compared to RSV, both HMPV and RSV hit babies and the elderly hard, but HMPV seems to really hammer 6 to 12-month-olds. Compared to COVID-19, HMPV is more seasonal winter and spring, unlike COVID-19, which can pop up anytime. I'm so worried about this. 6. Treatment. HMPV is a respiratory virus that spreads easily through droplets, direct contact, and contaminated surfaces. There's no vaccine or specific treatment, so prevention is key, especially for vulnerable groups like young children, the elderly, and people with underlying health conditions. It's really worrying how easily it spreads. Seriously, guys, let's be extra careful about hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap's not available, use a hand sanitizer with at least 60% alcohol. Do it after coughing, sneezing, or touching anything in public. And please, cover your mouth and nose when you cough or sneeze. Use a tissue or your elbow, not your hands. Toss used tissues in a bin and wash your hands afterward. Most importantly, try not to touch your face, especially your eyes, nose, and mouth until you've washed your hands. I'm getting a little worried here, people. Let's all do our part. Cleaning up is such a drag, but we really need to disinfect everything. Door handles, tables, phones, even the kids' toys need a good scrub with disinfectant. And please, let's get some air circulating. Open those windows, especially in stuffy rooms. Maybe we should even get an air purifier or humidifier. Anything to cut down on germs and make the air cleaner. I'm so worried about getting sick. Keep your distance, okay? Avoid close contact with anyone who's sick. No handshakes, hugs, or getting near anyone coughing, feverish, or struggling to breathe. Seriously, try to stay at least 3 to 6 feet away from others, especially in crowds. I'm a little worried. Wear a mask, please. Seriously, especially during the winter and spring when respiratory illnesses are at their worst. If you're feeling sick, a mask is a must to protect others. We need to be careful out there. Feeling sick. Stay home if you have cold or HMPV symptoms. You don't want to get others sick. But if you're really struggling, like trouble breathing or a high fever, please see a doctor right away. I'm so worried. Human metapneumovirus, HMPV, might not be as famous as other respiratory viruses, but it's just as dangerous, especially for kids, older adults, and people with weak immune systems. Seriously, we need to be careful. Knowing about HMPV and taking precautions can really help protect you. If this helped, please like and share. You could save someone. Subscribe for more vital health info. Stay safe, everyone. See you next time.